This is my presentation as part of the T2T program for Harvard. The topic I have selected is, can your mobile be a useful tool in vascular surgery? By Mr. Muhammad Omar Al-Farouk, consultant vascular surgeon and Royal College regional advisor and examiner. My learning objectives is to demonstrate what is vascular mobile application, explain how it is being used, and have a conclusion. The medical mobile application can maybe even more than 7,000, but the one which are related to vascular surgery can be around 50. They are basically on two platforms, either Android platform or iPhone. Before starting to discuss the mobile application, there is very nice document which by FDA regarding the policy of how to use mobile application in our medical practice, and it's very useful guideline. Regarding United Kingdom, we can use the Medicine Healthcare Product Regulatory Agency or MHRA. We like to use tools as all surgeons, especially vascular surgeon, and mobile phone can be actually one of our best tools in the current era. According to Wall Street Journal, around 72% of doctors have their own smartphone, and 95% of them have already downloaded some sort of an application on their device. The two mobile applications that is very useful is the iPhone and the Android. They are nearly around 90% of the smartphone in doctor's hands. So what mobile phone we can use in vascular surgery? Over the next slide, I will try to summarize the most important of these vascular applications. I will try over this slide to summarize the most important of them. Number one is the anatomy mobile apps. And these are very useful to revise the anatomy, the bone, and the muscle structures. There's also drug app like Hippocrat, which is very important and very nice mobile application. You can also review an operation by a very nice app which is called Touch Surgery, and you can actually perform the operation on your mobile. Now, logbook, which we recommend, e-logbook, can also be done electronically through your mobile app. You can review the best guidelines from European Society of Vascular Surgery guideline on your mobile app. You can actually read the DICOM review of your patient X-ray through a DICOM mobile app. You can also perform some sort of operation like appendectomy on touch screen. All these are vascular mobile hand in the hand of our vascular registrars. Omneo is a combination of guidelines, library, textbooks, and extremely useful to vascular surgeons. I've also used the mobile application as a way to review the vascular registrar. I've told them, whenever you do a puncture, let us record it in the video and review it after that. This is, you can see how he moves his hand, how he press on the femoral puncture to prevent bleeding. Again, it also can be used as a duplex scan. Now Microsoft have been able to purchase a device which is actually a probe, can be connected to the mobile application and give you a carotid duplex scan straight away, and actually now it's a fact on the ground. You can also have your own virtual clinics through multiple platforms like Vernicia, like Dr. Gallen, multiple platform, and in United States now we have more than around 1 billion virtual clinic last year. There's also COVID related application which will tell you recent changes in guideline. You can have tracing where if you are in a dangerous zone. You can also notice what has changed in the guidelines, and you can get an immediate health information. So mobile application, as in South Korea, was very useful tool during COVID-19 epidemic. wise man once said, computers are incredibly fast, accurate, and stupid. Humans are incredibly slow, inaccurate, but brilliant. I totally agree with this. And we used to say vascular surgeon must have a heart of a lion, eyes of an eagle, and hands of a fine lady. I would like to add, and the smartphone is a must. And this is my abbreviation for today for this presentation. By the way, this presentation has been done using my mobile, which is Samsung Galaxy Note 9, using PowerPoint presentation. Didn't need to do it on my laptop. I would like to thank again Professor Jeremy Richard for his excellent and great course in Harvard University, and for giving us such a great time with his lecture. I wish you all the best.